3, 2.
Welcome to Home Care Connection. I'm Harry Snyder with the Rutland Area VNA and Hospice. In addition to providing home care services, RAVNAH also provides end-of-life care through our hospice program. Many of you who have had a family member or loved one receive hospice care. We've taken care of hundreds of people who have chosen hospice as a way to live their lives to the fullest till the very end. Our show today is about planning for end-of-life care and how important it is. Few people know their end-of-life options, and still fewer have discussed their wishes with their doctor and their families. Knowing your end-of-life care options and having a plan makes it easier for you, your doctor, and your loved ones if in the future decisions about treatment need to be made when you are unable to speak for yourself. Today I'm joined by Laura Vien, the manager of our Community Relations Program. Welcome to the program, Laura.
Thanks, Harry.
This is really a very sensitive topic, this topic of end-of-life planning. And not many people want to take the time to plan for the end of their lives. But you are here today to talk about that very topic, are you not?
Yeah, and you're right, it is a very sensitive and very personal issue. I know that when I go out as the community relations manager to talk to groups about this very topic, just the expressions on people's faces just show you, how tentative they are, because nobody wants to talk about the end of their life or the end of the life of someone they love. But hopefully, by the time we finish the show, we'll convince people the importance of doing just that.
And I think that is certainly a noble effort on our part to try and do
yes,
that.
Yes, it is. and it is very important.
It is. So the name of the program is Start the Conversation, which I think, makes a lot of sense because aptly we are, in fact, trying to start a conversation about end-of-life planning. So perhaps you could tell us who are the people that are involved in the initiative.
Yeah, let me give you a little bit of history.
Maybe,
Start the Conversation was, we discovered it last year.
Okay.
It was being done by a hospice agency in North Carolina. And we thought it was of great value because rather than people trying to decide what they want at the end of their lives when they are in crisis, this initiative eased people into it by just encouraging them to start talking about it. And so we thought, this is of such great value. We want people to know more about hospice and their end-of-life care options. So maybe it was something that we could adopt here in the Rutland area.
Sure.
We also had an opportunity to talk to the other visiting nurse associations around the state, the other nonprofits.
Oh, okay.
And again, everyone saw the value, so we decided that it would be something that would be worth doing across the state because here in the state of Vermont, although home care is highly utilized by people, we have the lowest utilization, one of the lowest utilization rates for hospice services in the country.
Oh, really? Wow.
So we thought, well, maybe this is a way for people to start thinking and talking about what their end-of-life options are and what do they need to do to make a plan. It's a little bit like retirement planning, well, we plan for a lot of things, right? I mean, we
Yes.
plan to get married, we plan when it comes time to have children, we plan our retirement. But like you said in the opening, who plans for the end of life?
Right.
So the folks involved in this are all of the local nonprofit VNAs
Oh, that's great.
and home health agencies in partnership with the Vermont Ethics Network, because they're very involved in end-of-life care planning, so we certainly wanted to bring them into the process.
Sure, that makes sense. So then, so this is really, the Start the Conversation program is really an effort that is statewide through all the VNAs and as you said, the Vermont Ethics Network.
Correct.
And the Vermont Ethics Network has a particular role? What is their
Well, because as we get into the show, we're going to talk
Yep.
about what end-of-life care planning means, and one of the things it does mean is having an advance directive, and Vermont Ethics Network is the expert in advance directives. They
Okay.
work closely with the legislature, with
Yep.
hospitals, They have all the necessary forms, all the resources to complete an advance directive.
Okay. So maybe we start just sort of right at the beginning. I mean, why is it important to start this conversation?
Well, as I mentioned earlier, we have life plans for a lot of different things, but I just want to cite some statistics while I have
Sure.
a moment. Studies by a variety of organizations shows us that 8 out of 10 of us, 8 out of 10 Americans, would prefer to die at home if they can.
I believe that.
That's 80%.
Yeah.
But despite that statistic and the wishes of all of us, only 20% do.
Wow.
So 8 out of 10 want to, 2 out of 10 actually do.
Wow.
So that's an important statistic to know. Another one is that 3 out of 10 Americans have an advance directive, and we're going to get into what that means.
Yeah.
But basically, an advance directive is saying, I'm going to choose you to make healthcare decisions on my behalf if the time comes that I am unable to express my wishes. That's what an advance directive is.
Okay.
And 3 out of 4 Americans really don't understand their end-of-life care options. What does that mean?
Yeah.
My end-of-life care options.
Yeah.
Some people who may be listening right now are saying, if I'm nearing my end of life and I have a chance for treatment that's going to keep me living, that's what I want. And then there are going to be others who are probably sitting here right now listening to us saying, I don't want all these, exceptional, prolong my life treatments. I want to enjoy the end of my life with a full quality of life.
Yes.
And when I'm called to go, I want to quietly go.
Yeah.
And so we all kind of fit somewhere
It's
in between
that.
there.
Yeah, no, and I think that's really true.
So why is it important is what you asked me. This is not just for elderly people who are, chronically ill. This can be for a young family. It can be for man, woman, at any age, because we never know what could happen to us, whether we get in a bad car accident, whether we do end up with a terminal illness and we're rendered unconscious, unable to speak for ourselves at any age. So who's going to make the decision? Who's going to say, keep my mom alive or let her go?
Absolutely.
So we want to make sure that whatever our personal wishes are, that we choose someone to communicate those wishes the way we would want them to be communicated.
Yeah.
And, there are a lot of experiences that I can share today on the show that will tell people why it's so important. And let me just share one right now.
Sure.
I'm going to say it was about 20 years ago, my mom passed away. She had cancer for a long time, and she got to a point where, the treatment had just become worse than the disease.
Yeah.
And she was over at Dartmouth in Hanover at the time. And her oncologist brought us all together, the family together, children and my dad, and said, there's nothing else that we can do. I've been treating your mom for a long time, and I really think that she would not want to go on as she was, completely non-communicative.
Yeah.
And so I said, I think you're right. I don't think our mother would want that. Now, I did not know that because she had never started a conversation with us about what she wanted. But I was the one who spoke up and said, I think you're right. And so after some emotional time amongst us, it was decided that nothing else was going to be done. We were going to let her go. After that point, I got in my car and I drove back to Rutland, and that whole time I thought to myself, is this really what she would have wanted?
Yeah.
I really didn't know. I made an assumption, and that was 20 years ago.
Yeah.
And so even today, especially now that we're in the midst of all of this campaign, I still wonder. I really think in reality, in her state as she was, there was nothing that could be done. The decision really didn't even need to be made, but you still always have that little doubt. And now if we had gotten together as a family and she had communicated her wishes in a situation like that, I would have had complete peace of mind because I know I would have honored whatever those wishes were.
And even though you clearly knew your mother well, and believe, and probably still believe, at least 99.9% that those would have been her wishes. I absolutely understand what you're saying. I mean, that even though it's 1 tenth of 1%
Right.
of doubt, it will always be there. And again, it's because she did not set up in advance what
Right.
her wishes were.
Right. She never even told us verbally.
Yeah.
Because it's a conversation, even though she was very,
question.
very sick and dying.
No question.
It's not a conversation people want to have. So when you ask why is it important, that story, I hope, translates into why is it important.
Yeah.
For those of us who are left behind
Yeah.
to have peace of mind.
Yep.
For those people who may be in a health crisis,
Yep.
to know that when they go, or when it comes time to be close to going, that they've communicated their wishes, and their family members or their healthcare agent they've chosen is going to honor those wishes.
And, I think that, when you think about that just purely from that standpoint, you can see how a person who does take the time to think about how they want the quality of their last days to be, really speaks to, something both real, like it's about themselves and about what their values are and what they felt was important. And there's even almost a spiritual dimension to that, in the sense of just purely, how do I want my last days on earth to be,
Right.
as it relates to, especially for those who may be here after me, and how,
Yeah, for those loved ones that you're leaving behind.
Right.
Absolutely.
I mean, to be able to offload that decision that you had to make, even though that decision was probably almost certainly the right decision, to eliminate that 1/10 of 1% is a gift well bestowed.
Right. And I wonder, oftentimes, the children, of course we were
Yeah.
adult children, there were 3 older brothers and me. And so oftentimes I'll say, why was it me? Why was I the one to speak up?
Yep.
Probably because I was the daughter. I don't know. But so I just, the 3 brothers didn't have
Yeah.
to make the decision.
Yep.
Even though I wasn't the designated agent, my dad
Right.
wasn't a designated
Right.
agent. He couldn't have made that decision. He was in such an emotional state, even if he
Sure.
had been chosen to. So
Yeah,
anyway.
and that makes complete sense.
Yeah.
So, all right, so, clearly we can imagine why it would be important to start this conversation. So who should start the conversation? Who is involved in that?
Great question. Parents. Someone who wants to give a gift to their children so they don't have to make the decision
Okay.
that I just
Yeah, talked about,
described. People who are starting a young family, who, especially if you're young and you're not suffering from an illness that's probably going to take you, but you get in an accident. What do you want? So that person,
Yeah.
anybody of any age, a tragedy, an unexpected event can happen to any of us. So basically, every adult
Yeah.
who has the capacity to make an advance directive should be putting those plans in writing.
I mean, it's funny, as I'm listening to you, what comes to my mind is something like life insurance, where really, you ask the question, who should get life insurance or when should you do it? The reality is that whether you are, a young adult or whether you are a parent or a spouse, I think the answer is pretty much the same.
Nearly
because it's
everybody.
really, again, it's partly about, or maybe it's all about me, about the person doing it, but it also, if I take care of my wishes and make them known, I'm also directly helping loved ones not have to
Right.
make those decisions.
So you said who starts the conversation and how do you start the conversation? What this whole campaign is about is to provide people the tools,
Yeah.
the resources, the materials they need to do just that. We're not saying, hey, you should have an advance directive.
Yeah.
Here's the form.
Yeah.
Take it home and fill it out.
Yeah.
We're saying there needs to be some discussion. Who do you want to have this discussion with? And how are you going to do it? Because we anticipate that most typical families are going to have some resistance.
No question.
Dad and mom aren't going to sit down with their children and say, now we're going to talk about my wishes so that this happened, because the kids are probably going to go, I don't want to talk about
Absolutely.
this. And if the adult children who have elderly parents approach their parents and say, you know, Mom, Dad, I think we need to have a conversation if something happens to you. I don't know what you want.
Yep.
You know, you envision the adult parent saying, oh, wait a minute.
Really, don't write me off yet.
Exactly. So the materials that we have put together, and I apologize for not bringing the booklet, but we can talk about them.
Yeah.
Will help people initiate the conversation and bring up the points that are most important. And one of the things that's in there that I think is terrific is what's called a medical preferences test.
Okay.
It's a 10-question quiz.
Okay.
And it would be like, say the two of us take it. And
Sure.
let's say, Harry, I want you to make the decision for me. I'm going to appoint you my healthcare agent.
Okay.
In case anything ever happens to me. Here are my wishes. So I take the test.
Okay.
And it outlines a variety of different scenarios where I can choose what I would want in that particular scenario.
That makes sense.
And each question is assigned a number of points.
Oh, okay.
Okay. So now I want you to take that exact same test because I'm considering you to be my healthcare agent.
Yes.
But you're answering those same questions as you think I would have answered them.
Okay.
So in other words, let's say for an example, if Laura were to get into a serious accident and was in a coma, she would want me to do X.
Okay.
Now I've answered that question the way
Right.
I think I want it. And so you take the test, I take the test, then we compare the answers.
Wow.
Ideally, we're right on. You know, we're each 10 for 10. Well, my husband and I took it,
Yeah.
and guess what? We weren't even close. So that starts, really?
Yeah.
That's what you want?
Yeah.
I never would have guessed that in a million years.
Yeah.
I would have thought you wanted this to happen.
Yeah.
And so that's a great way to start the conversation.
Yes, it is.
To each take this test. And to sit down and say, well, okay, what if you said to me, well, Laura, what if you lost your sight?
Mm-hmm.
What if you were to live your life in a wheelchair?
Yeah.
What if you were to have,
Feeding
no
tube
use
or
of your
something.
limbs or
Yeah.
no limbs?
Yeah.
What scenarios would you want me to take action if
Yeah.
you couldn't speak for yourself?
Yeah.
And that gets people thinking about it. And, we're not expecting, again, that people are going to do this quiz or take some of the questionnaires that we have in here and have that decision made. This is not that kind of a decision.
No.
And I think a lot of people are afraid that if they put their plans in writing today and they change their mind,
Sure.
they're locked into what they said. That's not the case.
Right. We know that that's not true, right?
Right. That when we have an advance directive,
Yeah.
actually, once you complete it, it should be looked at on an annual basis or during certain life situations.
Mm-hmm.
And you can change your mind at any point. If you say, oh, I thought I wanted to have X happen, but now, you know what? Maybe not. Maybe
Yeah.
I've changed my mind. But the thing is, you want to do it when you're cognizant, when you're not in a healthcare crisis, when
Right.
you're not in a serious situation. That's when you want to have the conversation and complete your advance directive, not when you're facing a life or death situation or you're in a serious healthcare crisis.
And I was sitting here listening to you talk about this and thinking about it, and it occurs to me that if an individual does have someone with whom they can go through this exercise with, especially when they are of, if you will, sound mind, and maybe even sound body. If that circumstance changes and that person is facing end-of-life choices, just having had the initial conversation and just knowing that there's someone who you've already sort of gone through this planning with, I would think actually provides for a level of comfort that you might not even, that a person might not even realize would be possible, because it's not going to be now this super scary, taboo, never talked about thing. It'll actually be something, where when we were saying, a year ago or a month ago or 10 years ago that these were the things that you thought were important to you then, are they still important to you?
Right. We had an opportunity to visit an assisted living facility, not in Rutland, it was outside the city, where we spoke to obviously elderly people.
Sure.
And we asked them, how many of you know what an advance, I think I'm going to say there were a couple of dozen people in the room. How many people know what an advance directive is? And out of the couple of dozen people, a few hands went up.
Yeah.
How many of you have an advance directive? And only probably the same hands went up. It was a surprise to us. And again, it's not that only elderly people should have them, but
Right.
you would imagine
Right.
that
You would
those are
think, yes.
those are the folks that are going to be
Yes.
thinking about these things. That so few of them had one or knew what it was.
Yeah.
And we'd like to think maybe we got them talking and
Yeah.
thinking as well.
Well, and so, you know, you've touched on the term advance directive a couple of times. You know, in thinking about perhaps end-of-life options, you know, what is the best way for people to make their end-of-life wishes known?
Well, the best way is to complete an advance directive. An advance directive is a legal document
Okay.
that specifies what you would or would not want for treatment in certain situations
Okay.
if you are unable to speak for yourself. It is not somebody else speaking for you when you're capable of speaking for yourself.
Okay.
It's only at a time when you are in a state that you can't. So that's the best way. Complete the advance directive. It's a bit, I'll say, comprehensive. You know,
Okay.
it takes some time to sit down
Sure.
and fill it out. It's not something that you're going to do, 20 minutes while you're making dinner.
Right,
You know,
right.
you need to put some thought into
Yep.
it. Having an advance directive means that you choose an agent to make
Okay.
who's going to make that decision. You don't want the whole family, as in the scenario I described.
Right,
So you
right.
want, because how many families get into a situation where the son thinks the parent wants one thing, the
Yes.
daughter says no, there's
Yep.
conflict and fighting. We've seen this on
Yes, on television,
TV.
absolutely,
It
no
happens
question.
all the time. And here you are in the most vulnerable of situations, the most sensitive time,
Yep.
and you're having these arguments.
Well, and again, like we were talking about earlier, I mean, you talk about this as it relates not only to my wishes being honored, but the burden that places on those
the
two
family,
siblings,
right.
absolutely, in a
Fighting
situation
over
like
the
that,
person
right,
in the
over
bed.
what's the right decision.
Right. So when you're considering, and you're starting to do this advance directive,
Yeah.
one of the important things to do is to identify a healthcare agent.
Okay,
Well, most people would say, my spouse.
sure,
That's not always the case.
right,
Could be a child. It could be your neighbor. I mean,
Yep.
it can be anybody that you choose that person to be. Somebody who is good in a crisis.
Yep.
Sometimes maybe not the person emotionally involved.
Right.
Somebody who can talk to your doctor when when treatment options have to be
That's a
considered.
great point.
And understands and is
Yes.
willing to ask questions of that doctor about treatment options. So careful consideration should be given to who you choose for an agent. That person, that you're going to trust that person to do what you said. That's inside that legal document.
absolutely. And I think you said that, I've heard the word legal twice. Do you have to have a lawyer to?
No, you don't.
Oh,
No,
okay.
you don't. And that's a great question, Harry, because I think people do hear legal document, and that means, oh, now I've got to hire a lawyer, and gosh knows how much that's going to cost me.
Yeah.
You don't. Forms are available to download and
Okay.
print if you go to the Vermont Ethics Network's website.
Okay,
You can get an advance directive from us at the Visiting Nurse Association, and if it seems a bit daunting to you,
Yeah.
we have people at RAVNAH, social workers who are skilled and knowledgeable, that will sit and help you complete
wow,
the document.
that seems like a wonderful
Yeah. So,
service.
yeah, that should not be an impediment or a barrier for
Absolutely.
people.
Yeah, no, I think that makes a lot of sense. And again, what keeps coming back to me as you're talking is this idea of this health agent, what'd you call it?
The healthcare agent.
A healthcare agent.
A proxy. There are
Yeah,
different names for that.
But again, I mean, somebody that you've obviously, if you will, started the conversation
Right.
with.
Yeah.
But more importantly, that you feel can represent what your wishes are. Whether it's getting information from a physician.
Yep.
There really isn't a right or wrong or specific person that it has to be.
That's right.
It's really just simply, again, who is it that you think can best help your wishes be followed if there comes a time where you can't speak for yourself?
Right. I believe that the only requirement is the person has to be over 18.
Okay.
And you can't have your
Yeah,
high school teenage
sure,
daughter
which I think that's,
to be your
that
healthcare
makes sense.
agent. Yeah. So, there's a lot to this, but our goal is to just get people talking about this and to consider your end-of-life care options.
Yeah.
The advance directive doesn't mean I'm saying pull the plug on me.
Right.
I don't like
Right.
that phrase, but you hear that
Yeah.
often. It can mean the complete opposite.
right.
My wishes are
To fight to the
To
bitter
fight
end,
to
no
the
matter
the
what.
very end.
Experimental, not,
Right.
I don't care if I can speak or,
Exactly. If I'm lying in a bed and I
Right.
can't communicate, and a doctor says to you, well, there's a treatment in Texas,
yeah.
and,
Yeah. Fly
that
me over
agent,
there.
right, exactly.
Well, and again, I think that's why, the idea that this is actually just simply a program through RAVNAH, through the VNAs, to start the conversation.
Right.
It seems to me that because there are so many different layers to deciding about what end-of-life care options are, and those end-of-life care options could even include something like hospice, I'm guessing.
Absolutely, absolutely. As I mentioned in the statistics that
Yeah.
I cited earlier in the program, that 3 out of 4 Americans don't understand the role that hospice plays
Yeah.
in end-of-life care. As I go out into the community in my role, I know that there are a lot of misconceptions about hospice. And I don't know if we have a few minutes on the show,
Yeah,
but we might be able
we
to
do.
talk a little bit about that. I think that right off the bat, when people hear the word hospice, sometimes it might send a shiver down them. They think it's about giving up. And I think that that's one of the worst misconceptions.
I agree.
Certainly, hospice is not an option unless you've received a prognosis from a doctor
Right,
that says
of terminal illness.
you have a terminal illness and you probably have, in my best judgment, 6 months or less.
Right.
So there's no denying
Right.
that.
Right.
But what hospice does is they are there to make sure that your final days, weeks, months, sometimes longer, sometimes even longer than 6 months,
Yeah.
are going to be the best that they can be. That our hospice team of specialists, nurses, therapists, aides, clergy, volunteers are there to support you
Yep.
and your family during those last months. So pain-free, hopefully controlling symptoms,
Yep.
so that you can get out and maybe see one more grandchild,
Absolutely.
another graduation,
Yep.
one more wedding, and you're not receiving treatment for your illness,
Right.
which we all know sometimes can be worse than the illness itself. So
Absolutely.
that's certainly one myth that we want to dispel.
Yeah.
That hospice can be delivered anywhere, home, hospital, nursing home.
Absolutely.
We come to you
Yeah.
and take care of you. Hospice is paid for by Medicare, Medicaid.
Yeah.
Virtually every private insurance
Right.
covers the cost of hospice. So that should not be a barrier for people.
No.
That is not just for cancer patients.
Right.
It's actually hospice services. I think it's about 40 to 45% of hospice patients have cancer. It can be heart failure, kidney failure.
Any terminal
Yeah.
prognosis.
Lou Gehrig's disease.
Diagnosis.
Yeah,
Yes.
absolutely. So I think that's a myth.
Yeah.
So when people find themselves in a situation where their doctor says you may have 6 months or less, they should consider hospice, because hospice is going to give them the quality of life that they may not be able to have without it.
And again, we are just about out of time, but I
Okay.
think that it's important to say, though, that like everything else that we talked about today, it is really about end-of-life choices and the options that are available to one at the end of one's life, and hospice is certainly one of those.
Absolutely, well put.
So that is all the time that we have today. We encourage you to start the conversation today. For more information, log on to our website at www.ravnah.org or call us at RAVNAH at 775-0568 and ask to speak to someone about starting the conversation. Thanks for joining us for Home Care Connection. I'm Harry Snyder, your host, and we'll see you next time.